There are lots of things that somebody with psychosis can do to aid their own recovery. I think engaging with their treating team is really important. Usually we will offer a number of different supports from lots of different health professionals within the team unit. Medication is usually a really important part of treatment for psychosis. So, firstly, taking your medication as directed by your doctor, but also vocalizing any concerns you have about your medication, any side effects you might be having is really important. And then, being upfront and collaborative with your team, I suppose being open to suggestions that they might have, and also, working with them to get your life back on track and to I suppose to look at some of the factors in your life that may have led to this happening is really important. So just being open to help. Some of the team members you might be asked to work with are someone like a social worker, a psychologist, an occupational therapist, or we even have dietitians on our team. So lots of different people there to help you. So just being open to the suggestions and open to that help. But also being, forthcoming and honest about your experiences, I think is really important as well. I think again, it's important to remember that for lots of people, psychosis may end up being a longer term chronic illness. So being there, in different ways for the person throughout the course of their illness. Again, that non-judgmental, empathic approach, showing them that you're there for them, but also at times, having to, I suppose, having to support them in a more direct way, and maybe challenging some of what they see or what they feel, and encouraging them to get help even if they don't want to. So that can be very challenging for family members and friends. But I think showing them that you do support them and being there for them is probably the most important thing that you can do. And also educating yourself on psychosis, just so that you have a sense of what the person is experiencing. I think finding your common truth when somebody has perhaps delusional beliefs is really important. So one of the common truths you can often find is, the person has noticed a change in themselves. So they might agree that their sleep is different, or that they have stopped working. So you can often find that truth and collaborate about that truth, even if the rest isn't something that they are willing to see your side on. And yes, as the person recovers and as the person improves and regains something that we call insight, so their ability to recognize that their symptoms are related to mental illness, family members and friends can have a supportive role in gently supporting the person to understand what has happened to them, and the role that mental illness has played. So there are lots of different resources out there to inform ourselves about mental illness. So the College of Psychiatrists in Ireland have lots of resources on the website. There's TED Talks. There's lots of different things that people can look at to both educate themselves, but also understand the experience. And collaborating with the person's care team is really important as well. So if you are a person's next of kin or a concerned family member, it's absolutely okay to ask to speak to a member of the team to understand how you can help them, anything you should or shouldn't be doing for that particular person, and all of the ways that you can help. I think, the first piece about stigma is understanding that this can happen to any of us. The concept of, othering, or that, that mental illness happens to certain cohorts of society is completely wrong. It can happen to any of us. Similarly, it's really important to bear in mind that most people with mental illness make a good recovery and return to living their lives as they would like to. So I think bearing those two concepts in mind, the other common piece of stigma that we often have to manage is this perception that people with mental illness are dangerous. So those with mental illness are more likely to actually be victims of violence than perpetrators of violence. And I suppose that knowledge and awareness that there are very good treatments for mental illness, and that most people recover within a relatively short time frame, and return to that person that you knew before this happened. So I think reminding yourself of that and educating yourself as much as possible is really, really important.